Hey everyone, this is Dylan with BJJ JAT. Today I just want to talk about H taping, another simple taping technique that you can use for collateral ligament support or to minimize irritation to the tops of your knuckles. All you'll need for the taping technique to help minimize knuckle friction is 1.5" tape and some sort of lubricant. Either chapstick, skin lube, or Vaseline will work. First, rip a piece of tape that's approximately 3 inches in length. Now rip the tape on both sides to make an H. Make sure the middle space is large enough to cover your knuckle. Apply a small amount of lubrication to the knuckle you're looking to protect. Now lay the H over the finger so the middle is covering the knuckle. Now close the H above the knuckle. Now bend your finger and close the H below the knuckle. Very simply, the finished product should look something like this. Now you could cover this with 1/2" athletic tape, or you can leave as is, but make sure you check range of motion, that you can close your fist before training, because we're not trying to limit range of motion, merely protect the knuckle with this taping. The H variation of the collateral support begins the same way. Lay the middle of the H so it is over the injured side of the joint. Now close the H above the joint. Before closing below the joint, pull on the middle of the H to provide tension and support for the side of the joint. Now close the H below the joint. Because the rigidity of the tape is important in collateral ligament taping, make sure to cover up both above and below the joint. The tape should end towards the ring finger to prevent rolling off. The finished product should look something like this. Make sure there is no unintentional loss of range of motion about the joint. Prior to training, as always, make sure you test the taping technique by testing the joint manually and then in a sport-specific gripping movement. As always, thank you for watching. I hope this H technique is another quick and effective way to help you tape your fingers to minimize pain and increase function. If you have any comments or questions, feel free to post them below or message me directly.